Regina and area vets are stepping in to help pets in distress during emergency situations. The 24-hour animal care center said earlier this year it didn't have staff to cover overnight shifts, but now 11 local veterinary clinics will rotate to cover that gap. Today on the show, we're speaking to veterinarians who are seeing the pinch in their own practices, and we'll talk to the Veterinary College about plans to train and retain more people in our province coming up in a bit on the show. Dr. Tanya Marshall is the owner of TM's Clinic in Lumsden. She is part of the emergency rotation for overnight care. CBC's Stephanie Langenegger spoke with her and started by asking what emergency pet care is available now.
So in the Regina and surrounding area, we are all on rotation as veterinary clinics. So what can happen is if you have an emergency after 8 p.m. to 8 a.m. in the morning, you can call the clinic that you regularly get care for. They will direct you to a specific number to call. And then upon that, it will be triaged. We are seeing what's called red level emergencies through that time of the evening. So those are really urgent cases that need to be addressed at night, and you'll be directed to what clinic to go to, and there will be a veterinarian and a technician to assist you with that emergency. So there will be care provided overnight. It will just be on a rotational basis, and it won't be at one location.
What's it been like for you and your clinic to try and meet the demands that people have for their pets?
It has been very overwhelming. Since probably pre-pandemic, we started to see an uptick in the amount of pet ownership. And currently, on a daily basis, we're seeing an increase in urgent care and emergency appointments calling in to see if they can find a spot within our clinic. Non-clients seeking appointments sooner than what they can get in with a regular veterinarian due to their full schedules. And then calls from pet owners that don't have a veterinary patient-client relationship looking for a veterinarian to help them with the care of their sick pets. So it is overwhelming for all staff, veterinarians, technicians, our reception team, our tech assistant team, just because you're trying to do your best. You're trying to fit in as many appointments as you can. There's now wait times. We're triaging appointments and things. And so, when people have sick patients or pets, and then they also have, we have our regular appointments and they have to wait because we're dealing with triaging cases, it can be overwhelming. Stress gets high, anxiety's there, and so it has been a big toll on the veterinary community, with our mental health and just trying to be there for everybody, but realizing that there's only so many hours in the day and so many hands that can assist with things.
What would help?
Well, I guess I've been thinking about this a lot, and we have many talented young people in this province and throughout Canada that would make great veterinarians and great registered vet technicians that we call nurses, if given the chance. Until we find a way to get them a seat at a vet college or at a tech school, we don't really have any real way of addressing the issues. We need more graduating vets and registered vet technicians. That opens up a lot more options for solutions. But until we address that, we're kind of just trying to tread water here. Currently, with today's tech and vet numbers, ideas like retention programs to keep graduating vets and techs within the province and developing a scope of practice to develop registered vet tech practitioners would really help and should be really considered, I think.
In the meantime, how are people treating you and your staff in this high-stress environment?
That's a great question, and one that brings up a lot of different emotions. There is, I know everybody is stressed at this time, but one of the things that we really ask clients, customers to remember that it's no different than on the human side, is that to be kind, to be understanding, to be patient. There are going to be wait times. We're seeing that, and you see that on the human side in emergency, while you wait for an emergency or even in your, waiting just for a regular appointment. That is what's happening in veterinary medicine as well now, and that, you not to book something half an hour of an appointment that you have at a vet clinic give yourself time in that clinic. Understand that all the team is trying to provide everybody care, and that and just to be kind in that situation and patient. And we're trying to do our best. We're trying to stay on time, but there are things that come up. I always say, veterinary medicine, it doesn't read a textbook. You're not always going to be on time. There's going to be things that come up, and just to be patient and kind, because that really, really helps. We are very stretched, very thin. We're working a lot of hours, it just, kindness is really the one thing that we ask, and just patience.
What about the money part, doctor? Because most people, when they access healthcare for humans, they don't have to pay up front. And, I've certainly had cat teeth cleaning done in the past, and was eye-popping to me. But then I realized, they can't just hold their mouth open for you. They have to have an actual procedure that requires a lot more time and care. But people sometimes think, gosh, that seems like an astronomical price to pay for care. And I just wonder if you hear about that as well, or have people say, well, forget it then.
Well, unfortunately, there is a cost to medicine, and there's a cost. We have veterinarians, we have nurses, we have our team behind us. And so, there is a cost to that. And so, unfortunately, I do see that there is going to be an increased cost moving forward, especially for after hours care, because you're looking at keeping a team, a trained team in there overnight. There's those types of costs that are required to keep that available to the public. There is a cost of care. I do say it's a good idea for people to look into, insurance and things like that, because even since the pandemic, on a weekly basis, we see increases in prices of different, medications that we use in a clinic or materials that we use. And so those costs keep going up. And so do veterinary costs, so do veterinary, just the overall, different equipment that's required in a veterinary clinic. Those costs then, unfortunately, have to roll over to client themselves for the care of their pet. So, it is one of those things that we do provide, care for all, but certainly having, kind of a fund there set aside so that if you're running into a situation where you have an emergency, that you have to, be able to afford that. We always provide estimates for clients so that they have, different different options to choose from. It is certainly something that I think we see on all levels, whether it's the grocery store, the veterinary clinic, or wherever you go. Costs have definitely increased since the pandemic.
What keeps you going, Dr. Marshall?
The love of what I do. I've been doing this for, you can tell the emotion in my voice. I've been doing this for 20 years. And I really do love what I do. I'm blessed to do what I do on a daily basis. Get to meet great people. I work with a great team. My team is clients, great pets. And so, we're all here trying to do our best and provide a service, provide medicine, great medicine to help patients in our area. All of us 11 clinics have come to the plate. We're going to make sure that it does have emergency services so that, people aren't having a 12-hour period of time where there's no one available for them. So I do, because of my love for, the pets and career. I do love being a veterinarian, and I love helping the pets that come through my doors.
Dr. Tanya Marshall is the owner of TM's Clinic in Lumsden. Well, we know there is a shortage of veterinarians in this province. The Western College of Veterinary Medicine at the University of Saskatchewan is trying to fix that. Dr. Jillian Muir is the dean at the college, and she joins us now. Good afternoon, doctor.
Good afternoon. Thanks for having me.
Well, thanks for joining us. Just any thoughts from what you heard from Dr. Marshall there?
Tanya's story is I've heard a lot, very similar stories. I mean, veterinarians want to, we really want to help your pets. We're doing as much as we can, but the demand has just increased so incredibly over the past few years that it's getting tougher and tougher.
You could hear it in her voice. I mean, the emotion, but also that she's represents vets who are burnt out. How common is this experience right now across the province?
Well, there's certainly a lot of, the demand for animal health care has just gone up. And I think with all of our veterinarians, they're in this job because they love animals and they love people. It's a very rewarding profession. And so they are going to continue to do whatever they can to help to maintain the health, keep your animals healthy, keep you healthy alongside with them. So
why has demand gone up? Is it population growth? I mean, more people adopting pets over the pandemic? Do you know?
Yeah, I mean, it has been. It's exactly that. It's increased demand for animal health care. Namely, more and more people are getting dogs and cats. It started before the pandemic, for sure, but there was a dramatic increase in pet ownership over, during the COVID pandemic. But that's put pressure on all areas of veterinary medicine. So not just small animal practices, but also large animal rural practices, regulatory medicine, and all the areas where veterinarians play a role. So there's a shortage, across the board.
Yeah, Doctor, I wanted to ask about that before we move on. Obviously, we talk a lot about dogs and cats. I mean, probably the most two common pets, of course. Can you talk about some of the other, household pets and, like you said, large animals? Because obviously we have a massive agricultural community or industry here. Just what kind of things are vets dealing with outside of dogs and cats?
Yeah, no, absolutely. So we've got Saskatchewan's very agriculture province, as you know, and there's a lot of the shortages of the vet workforce do extend into rural areas, and so we've got just shortages across the board for folks trying to get veterinary care for their livestock.
Are there some areas that are seeing the pinch even harder?
Yeah, some places do. They've got veterinarians and they're well supplied, but there are certainly areas in the province where we're definitely short.
How's northern Saskatchewan looking?
Yeah, very much. Northern Saskatchewan is a challenge. Some of those areas, and often there's been areas where there's been a vet, a senior vet has been there for a long time. What we're seeing is veterinarians are having a hard time recruiting new veterinarians. Smaller practices are having a hard time, getting more vets to come and stay there. So,
what kind of vet services are available for people in the north?
Well, certainly in the far north, there's the furthest north. I think with the vet clinic is in Prince Albert. So,
okay, wow.
So we do. The college does have a service where we our Northern Engagement and Community Outreach Service, where we do go up and provide vet care to La Ronge and to the communities around La Ronge, and then also at Ile-de-Crosse. That's not for livestock. That would be for dogs and cats. So the vet college is stepping up to provide vet care there, but because there actually are no veterinarians at all in those areas.
Doctor, how did it get so bad?
Well, again, it's because there's just been increasing demand. More and more people are getting dogs and cats. The dog population has just really exploded. I mean, you can see this when you think of all the big box stores devoted just to pets. I mean, it's just really it's just exploded. There's just more demand for veterinary services, for animal health services, and it's putting pressure, as Tanya said, it's putting pressure both on the veterinarians as well as the veterinary technologists.
What about on the veterinarian and the service side? Like, where are the difficulties in terms of getting people into these jobs?
Well, it's certainly not difficult getting people into the jobs. The real pinch for us then is, of course, the spots in vet education and vet colleges. So, we have been graduating across Canada as one of the 5 vet schools across Canada. We've been graduating enough vets just to keep up with retirement. But of course, this increased demand has been creeping up, and so we just really haven't been increasing number of seats available in the long term in veterinary colleges. So now the WCVM here in Saskatoon we are looking at both short-term and long-term solutions here. So 4 years ago, we actually expanded the size of our DVM class from 78 to up to 88 seats, and that was with some increased funding support from our partner government. So as you probably know, our college is the Vet College for Saskatchewan, but also the Vet College for Manitoba and British Columbia. And so each of our partner provinces increased funding for us so that we could increase our the number of veterinarians we can train. So that's been happening. The other thing that we're doing here at the college, we're working hard to increase the number of internationally trained veterinarians who can become qualified to work in Canada. So internationally trained veterinarians need to pass a sort of practical hands-on exam to be sure that they can be qualified and get their certificate of qualification to work in Canada. This is quite a complex exam, a 4-day hands-on exam where they have to demonstrate their proficiency across many animal species. And we are the only veterinary college, basically the only place in Canada that hosts this exam alongside the Canadian Veterinary Medical Association. So all of international graduates need to come to us to pass this exam. And we put on this exam multiple times a year. We're trying to increase the number of times that we can host this exam. But again, we're putting it on in using the same facilities that we're training our veterinary students in. And so we have a limited capacity to be able to do that. And then longer term, our last increase, as I said, we increased to 88 students, but that's now put this building at capacity. We can't fit any more students into our program, more than 88, and so a year ago we launched a feasibility study to determine what we're going to need in terms of spaces, in terms of new instructors, to significantly expand our DVM program so that we can accept more Canadians into our program and graduate more veterinarians for Canada.
All right, listeners, our guest right now is Dr. Gillian Muir, Dean at the Western College of Veterinary Medicine at the U of S. Have any questions, concerns, stories to share with us? Give us a call right now, 1-800-716-2221. Let's head to Ron on the line in Regina. Go ahead, Ron.
Hi, I don't want to direct my concern or my complaint at your guest there. She sounds like she's very passionate about her work and cares very much for the animals that she takes care of. But I had a bad experience a few years ago when I was in Moose Jaw, and my girlfriend's cat had a problem on a weekend, and the cat was obviously in some significant pain. We phoned the vet, and they said, yeah, they could look at the cat, but because it was Saturday, they were going to charge us double fees. And so we ended up traveling to Regina, found a veterinarian that was open that day and was able to fix us up in about a 15-minute period. So anyway, my question, that left a bad taste in my mouth. I was, wondering if the veterinarian in Moose Jaw, where we first, the first one that we contacted, where their concerns seemed to be more not for the welfare of the animal, but putting money in their pocket. And I came from an industry where I had to be available to the public 24 hours a day, and I didn't charge anything more for looking after someone if it was 3 o'clock in the morning versus 3 in the afternoon.
Ron, thanks for that. Gillian, just any thoughts on costs and the demand on evenings, weekends, potential price changes?
Well, it's a challenge. Remember that veterinary medicine is private medicine, and veterinary clinics really, they're not just clinics; they're mini hospitals. And so, as Tanya was talking about when on the morning show, animals, when they need their teeth cleaned, they need to be anesthetized, like for surgery. So you need all the capacity to be able to do that. There's lots of staff that you have to hire and maintain. And so yes, most clinics do charge an emergency fee if it's an after-hours fee. It's not it's a challenging but very rewarding profession. But yeah, I mean, as long as the folks can remember that it's privately funded, it's not a publicly funded kind of medicine.
Ron, thanks so much for the call, and stay tuned because we'll talk a little bit more about that coming up in the next half of the show with another veterinarian as well. Let's go to the Agata in Regina. Go ahead.
Yeah, hi. So I have a question or a suggestion, if it has not already been looked into. But what about, so let's say somebody in their later career wants to change jobs and is looking at maybe entering the workforce in veterinary care. Obviously, they don't want to commit, years and years of training to specialize in all the areas. Is there a certificate program or a diploma-based program where somebody can tackle on specializing care in, say, dogs or cats or hamsters, just in one animal group or an animal species, and getting their foot in the door that way, and then obtaining a little bit more hands-on training as they work in the practice, and that would maybe alleviate some of the backlog and also provide more resources for the pet owners when they make those initial calls.
Jillian?
Sure. It's an interesting suggestion. The thing about veterinary medicine is that it is very when one graduates with a veterinarian degree, it's a general degree. We talk about our goal here at the Western College of Veterinary Medicine is we're training folks to go into mixed animal practice. That is, being able to do large animals and small animals. There's no sort of specialized licensure that allows people to really focus on one species more than another. Some people do, but the licensure really is a general licensure. And so in order to be to work in the field as a veterinarian and provide veterinary care, one does need to be licensed as a veterinarian and needs a veterinary degree.
Understandable for sure.
Agata, thanks so much for calling. Appreciate it. Dr. Muir, before we let you go, just a lot to think about already, but anything else you want to highlight in this industry, I guess, in the college and your hopes for the future here?
Well, I hope we're working very hard. Just so everybody knows, we're working very hard to accept more veterinarians and more veterinary students, to graduate more veterinarians, and we will be for the next couple of years. But it just also encourage people to think about veterinary medicine as a career. It's a wonderful career. It's a rewarding profession. Veterinarians want to look after your animals, and so I'd encourage anybody who are thinking about it as a profession, please look at get onto our website, look at it as a possibility, because there's so many different possibilities for a career in veterinary medicine.
Well, Doctor, thanks so much for taking the time.
Okay, thank you very much.
Dr. Jillian Muir is Dean at the Western College of Veterinary Medicine at the University of Saskatchewan. Of course, we're talking about veterinarians, pet care, and we know there is a shortage in our province. Some are only seeing pets on an emergency basis, and that no doubt means many questions are going unanswered by pet owners. Well, now is your chance to get some of those answers. For the remainder of our show, Dr. Tracy Fisher is here with us. She works at the Albert North Veterinary Clinic in Regina. Good afternoon, Dr. Fisher.
Good afternoon.
Folks, also, Dr. Fisher, as I mentioned, is willing to answer your pet care questions today, but just a note that she cannot give specific medical advice over the phone. So any general questions about pet care or stories, we'd love to hear them and try to help. So, Dr. Fisher, I know you've been listening to the program. Just any general thoughts to start?
Yeah, I echo a lot of what my colleagues say that we are stretched a little bit thin these days. We still very much want to help you and your pets, but also be aware that because of that, you may have to wait for services, and you may have to be flexible in the appointments and things like that you take. Sometimes, we're full. We have emergency spots open that we don't book in advance every day, and most of those are full by about 9:30 in the morning. And if you call later, you may be asked to drop your pet off or wait or things like that. And just realize that we are trying to accommodate you, but we can't always just get everybody in exactly when they want to be seen.
Well,
but we are doing our best.
yeah, Doctor, you do bring up an interesting point that I didn't consider. Is there a
Mhm.
busiest time of day? Time of week? Obviously, we know overnight emergencies are more difficult. Can you just talk a little bit about that?
Yeah, well, I mean, if it's very unpredictable as far as emergencies are concerned, but definitely Monday morning or the day after a long weekend tends to be very, very busy. Other times, can be a little bit quieter. Typically we try to spread out our wellness visits during the day, kind of mid afternoon or on Saturdays. But yeah, it can be wildly variable as to when things happen, and we all know things happen at the worst times
Yeah, of
for
course.
people, and so it can be a real challenge. Yeah.
How has your practice changed in recent years?
Well, I mean, certainly the number of people we've been trying to accommodate has changed a lot. Like many professions, we have seen retirements and things like that due to COVID, and graduation rates not keeping up with retirements and people leaving the profession. So we've had to adjust our schedules. We've had to try and see more people in a day, and that's been challenging. We've also had to shorten our office hours due to lack of staff. We used to be open every evening of the week, and now we can only be open one evening of the week just due to staffing shortages. And that's been a challenge. But like I said, we adapt and we do the best we can with what we got.
Well, Dr. Tanya Marshall in Lumsden says, the onus is on the government to create more vet spaces at the college. The college obviously wants more students. Just any thoughts on how we can act on this?
Yeah, well, I mean, certainly contacting your MLA, and your member of parliament and asking them to support that. Federal infrastructure funding for the college, and then just provincial funding for those seats. Anything that the public can do to help support that's really useful for us.
All right, folks. Again, right now we are talking to Dr. Tracy Fisher at the Albert North Veterinary Clinic in Regina. And Dr. Fisher is willing to answer your general pet questions. So let's head to Maple Creek. And Louise is on the line. Go ahead, Louise.
Hi, thanks for taking my call. I love cats. I've had cats on and off for many years. And my current cat is only 2 years old. I know where she came from. It's the first time I've ever had a cat that I knew her birthday because she came from my friend's ranch. But anyway, I had her get all her shots and had her spayed and everything last year. And so we're coming up to year 2. And what I'm really wondering is, to be a responsible pet owner, what things should she have checked at her checkup every year, and what shots should she get?
Yeah, well, that's an excellent question, and it really varies a little bit with your cat. So, if your cat is strictly indoors, then many of us will go do a 3-year vaccine schedule after the first year. So she'd get a booster this year with all the things that she needs, and then we would do it every 3 years after that. And if your cat goes outside a lot, we might increase that interval because they may be encountering more things. And obviously, if she's outside and hunting mice and birds, then we need to be deworming her fairly regularly. And if not so much. And at every visit, your vet is going to check out those teeth. Those teeth are really important. We see a lot of cats, and especially young cats, with some dental disease fairly early in life. So that's something that needs to get checked out every year. And of course, a good general physical, listening to the heart and lungs, and a good feeling. And also keeping an eye on that weight. One of the biggest problems that we have with a lot of our kitty cats, especially if they stay indoors, is they get a little chunky because they like to be couch potatoes, and if the food's out all the time, they can be fairly energy efficient and get themselves a little bit too chubby. And so getting on that at an early age is really important. But it sounds like you're doing all the great things for your cat, Louise, and hopefully she's going to be with you 22 years and not just these first 2, and you'll have her for a long time.
Well, my previous cat she was almost 21. She was like a month or 2 away from her 21st birthday. So yeah,
Ye-
but that
Yeah,
was a while ago.
those barn kitties, they're tough. They've got good genetics.
Awesome. Louise,
Okay,
thanks
thank
so
you
much for
so much.
calling in. And Dr. Fisher,
Yeah, thank you.
you provided a perfect segue talking about our chunky best friends because Dorothy has a question about that. Dorothy, go ahead.
Go ahead.
Hi. I'm just
Hi.
wondering, my little dog is chubby. She's not horribly obese, but trying to take weight off her has really been hard, and because she seems hungry all the time. So I just wondered if you had some tips on taking some, the weight off of them. I know it's not healthy for her, and I'd like to get on that if I can. So I'll just hang
Yeah.
up and let you
Oh,
answer
yeah.
me.
Well, thank you, Dorothy, for calling. That is a super common question, and I have to be honest, I would be a rich woman if I had the secret to weight loss without hunger. We struggle with that with people, and anytime an animal is in a calorie deficit, then going to lose weight, they quite often have feelings of hunger, and that is a real challenge as a pet owner to watch your animal give you those eyes and like, oh, I'm going to starve to death. And it's tough. It really is. We also know now, after many years of research on weight control, that the body really does a good job of changing its metabolism to try and hang on to that weight. So, people say he's eating next to nothing and he's not losing weight, and they're not wrong. It's a big challenge. So, a couple of things that can be very helpful. Certainly adding a little bit of bulk to the diet, and an easy way to make them feel a little bit fuller without actually giving them more calories is to add some water, some warm water if you're feeding them kibble, some warm water to the food, let that soak, and that'll bulk that up a little bit and make them feel a little bit fuller at a meal. Certainly, if you're going to do a true diet, I would contact your veterinarian. Most veterinary clinics will help you out. Your veterinarian should be able to help you out with an actual diet, figure out the calorie content that your dog needs to be eating. And if they're very overweight, might recommend a diet that is very high, a bit higher in fiber, again, for that full feeling. And that can be helpful. And then just like you and me, exercise. And another little tip sometimes is, instead of doing 2 meals a day, split that into 3 smaller meals. And sometimes that makes animals feel a little bit more satisfied. But I empathize with you. It's a tough go. And I want to say thank you for recognizing that you have an issue, and good work for trying to do something about it.
And Dorothy, thank you so much again for calling in. Again, folks, if you're just tuning in, our guest right now is Dr. Tracy Fisher at the Albert North Veterinary Clinic in Regina. Dr. Fisher is answering your pet questions right now. Just a reminder, she can't give you specific medical advice over the phone, but already very many helpful questions and answers so far. So let's stick with the phone lines. Barry is in Loreburn. Go ahead, Barry.
Yeah, my question for your guest is whether she knows if any provincial veterinary associations in Canada have banned ear cropping and tail docking, and if they have, how is that monitored?
Yeah, Barry. So yes, actually, many jurisdictions have. I don't have that list off the top of my head. I believe ear cropping is banned in Saskatchewan actually right now. It is monitored strictly by a complaint system. So the provincial associations don't necessarily go out looking for that. But if somebody were to make a complaint that so-and-so was doing such and such a procedure, if it was considered improper practice in that province, then the veterinarian could have a professional complaint lodged against them.
Barry, I just looked it up, and I see that cosmetic procedures such as ear cropping dogs and declawing cats is illegal to perform in Saskatchewan.
And I'm also wondering if the Canadian Kennel Club allows Dobermans, for instance, to appear in a show where they haven't been docked or cropped.
Yes, actually, they do. So that The Canadian Veterinary Medical Association has been working on that with the CKC, and for many years now, to the CKC's credit, and technically those dogs are allowed to be shown with full ears and full tail. However, like many fashions or fads, then there is sometimes perceived preference for one look or another, and whether that's a good thing for the animals or not is another issue.
Yeah. Thank you very much.
You're welcome, and like you, I suspect that we would like to see the end of those things, because they're really not necessary, and they cause animals a lot of pain and discomfort when it's done.
Absolutely. Dr. Fisher, I wanted to ask a bit of a question from personal experience, because I know, obviously we have more pet owners in the province. A lot of people would be new pet owners when they adopted, like me, during the pandemic. One thing that I struggled with was just my paranoia that there was always something wrong with my dog, right? I was just terrified something would happen to him. Can you maybe talk a little bit about that? I'm sure I'm not alone.
Yeah, a lot of people are uncertain, just like new parents, right? You have your first baby, and you're worried to death that something's wrong, and that's just a natural feeling. And over time, you get a little bit more experienced with that. And I don't know that there's really any cure for that other than working through it. I can tell you that I would far rather hear from a worried pet parent or worried owner on the phone and just go, "Oh my God, my dog is doing this," and me thinking, "Oh, that's not such a big deal," than having somebody ignore that problem, and maybe it's a big problem and they don't get in until it's either too late or it's much bigger problem than what it was early. So never feel bad about phoning and asking that question or reaching out for help. That's what we're here for. Like I said, I might not get back to you right that minute, but definitely I would far rather hear from you and hear about your concerns, and we can talk through that. And like I said, I think most people really do try and educate themselves, but it's just natural to be a little bit worried, especially in the beginning.
Doctor, I don't want to force you to generalize, or make people ignore things, but are there any common, pretty everyday things with pets that people call in about?
Yeah, the big thing everybody calls about is vomiting and diarrhea.
Of course, that's what I was worried about.
I was just to say vomiting and diarrhea every day, and so and in most cases, if your pet has vomits once and has diarrhea that is otherwise bright and alert, usually that's something that with just kind of a bland diet and a little bit of tincture of time and patience, that tends to go away in a day or two on its own, no matter what we do. But if that animal's repeatedly vomiting, they're lethargic, they're not able to hold down water, there's blood in the stool, then those are all things. Or if it's going on for 2-3 days, any longer than about 3 days of diarrhea, then we definitely want to hear from you. Or if it's something that kind of happens over and over again, they get vomiting and diarrhea, and then it gets better, and then the next week it's the same thing, and then it gets better, and then the next week it's the same thing. Those are definitely things that we want to hear from you about.
All right, folks, and we want to hear from you, or I'm going to just keep asking questions about my own dog. I'm wondering if, Kevin writes, I'm wondering if your guest has any tips to offer regarding desensitizing a dog that is petrified of going to the vet.
Yeah, so that's a good question. So a couple of things. We definitely have seen an uptick in this since the pandemic, because we weren't able to get a lot of pets in. A lot of pets didn't get that opportunity to go to puppy classes and things like that. And so they're a little bit under socialized sometimes. And well, let's be honest, who really wants to walk in the hospital some days, depending on the noise level and the smells. And sometimes that can be out of our control, are things that are difficult. So if you've got some time and some patience, then definitely call your vet, say, this is an issue I'd like to work on. A lot of times what we will do with those guys is try and schedule like a weigh-in appointment in a typically quiet time, maybe later on in Saturday afternoon, afternoon or later on in the afternoon, and have you just come in with your pet and weigh them, and we'll give them a treat, and then they can leave. And we'll do this several times, and then maybe get them in the waiting room. And if you just let us know that this is something that you want to work on, we can certainly make some accommodations for that. We charge nothing to weigh your pet and to help do that sort of aspect. If your animal does have to come in for a procedure or for the vaccine, or maybe it's sick, or I need to look at its ears and it's really quite petrified, one thing that is super helpful is letting us know a day or so ahead, or when you book that appointment, and we can get you some medications to give your pet that will help to relieve their anxiety before they come in. And that just helps everybody a lot, because, it helps that animal with their anxiety level, helps the owner, and it helps me be able to do things all in one go. Because if I can't get near your pet, then sometimes we have to send you home and come back with sedatives, or we have to get really heavy sedatives on board to do what we need to do some days. And that's unfortunate. We would really like to make it as smooth an appointment for your animal as possible.
Absolutely. Jake is on the line in Saskatoon. Go ahead, Jake.
Thanks very much. So I just wanted to touch on something that was commented on earlier, and maybe offer something for discussion in addition. So the cost of veterinary care and after-hours care or things of that nature, and just remind people these are by and large private businesses, and if you're trying to get care outside of normal business hours, there's additional staff that's going to be required. It's not like the vet's running off to the bank with bags of money. This is not a highly lucrative profession. I'm not a veterinarian. I've got elsewhere, but I've got friends who've gone through vet school, and I think by and large, like any of the healthcare fields, these are people who are doing it not because they're looking to make money. They're highly conscientious and realize that they're an opportunity that they can help and make a real tangible difference with their time and their skill set. And so I as a society, we can maybe afford this group a little bit of leeway and a little bit of slack, and try to figure out how we can support them. And I think veterinary medicine, the evidence is out there. It's very clear. Veterinarians need support. It's the highest rate of suicide among the healthcare professions. It's been like that for years, and there's no signs of it getting better. It's very stressful, and I just think that there's maybe some room to talk around that as well.
Jake, I appreciate the call. Thank you very much. Any thoughts, Dr. Fisher?
Yeah, thanks, Jake. I mean, thank you for your support. We really do appreciate it. And you do bring up a point is that veterinary medicine is private business. We don't get any government support. There are veterinarians that work for the Canadian Food Inspection Agency and for the government, but they're not in private practice. And so we have to recover our costs, and after hours is overtime for people. And I have to, when I'm coming in after hours, I need to bring in a technician with me, and I have to pay that person as well. And I can tell you that I'm going to be very happy if I break even on what I pay for people, and to come in after hours, and the triage service and everything else to provide after hours care. But we do it, and I'm happy to do it. I think it's an important service, but yeah, we're not. It is a business. We do have to make money to survive, and I will not kid anybody. It has gotten very expensive. The prices of everything that we do have risen dramatically, especially in the last 3 years. And I really do feel for folks. Access to care is a real concern and issue, and it is something that we encounter every day. And it breaks our heart sometimes. It's incredibly difficult to have people that just cannot afford care for their pet, and it's not that they don't love them. we do a lot of things to try and help people and stay within their budgets, but sometimes it's just not possible. So just a reminder to folks to try and be prepared. If your dog swallows something, eats a ball, and it needs surgery, in Saskatchewan right now, that is easily going to be a $3,000 to $5,000 bill by the end of the day, depending on how difficult that surgery is. So just put that in context and with your family, what might that look like? Pet insurance is a good option for people, having some money set aside if possible. But yeah, it's tough, and I realize that that's just not possible for a lot of families. And that whole moral distress is, and not being able to be there for people when they need it, and hearing, the anger and frustration of people when they've had to wait or something's gone wrong or what have you, really does contribute to that feeling of being overwhelmed and the stress and anxiety, and like you say, that high suicide rate, that high burnout rate in the profession, which is very unfortunate. Our
Doctor,
national...
I'm so sorry. It's a very important message. I really appreciate it, but we have 10 seconds left. Thank you so much.
10 seconds. Oh my goodness.
Thank you so much for this. I really appreciate it.
Thank you. Take care.
Dr. Tracy Fisher works at Albert North Veterinary Clinic in Regina.